So today we are going to talk about an important topic in neurology, that is multiple sclerosis. That is multiple sclerosis, or we will call MS. Okay, it's a very important topic. So basically, what is MS? We'll discuss and causes and clinical features, and what are the signs and symptoms, and we will see the diagnosis and after that treatment part. In the multiple sclerosis, it is the we have central nervous system. In the central nervous system, we have the neurons. Okay, okay. We have the neurons. Likewise, whatever. Okay. So we have covering of neuron is myelin sheath. Okay, myelin sheath. So basically, in the neurons, every part had different function. Dendroids, it take the information from the cell body, and from the axon, from the dendroids, it will go to the other cell body. Okay, axon, it is a long thread-like structure. Tail and cell body have nucleus. This is the main functional unit of the neurons. And we have myelin sheath. In some neurons, we have myelin sheath. Why does we have myelin sheath? Because we need to transfer electrical impulse rapidly, first thing. And second, in this regards, when you are supplying the electrical impulse rapidly, there is a chance of damage of axon. So this is a protecting agent of axon as well as protecting agent of axon. Second one is to send the electrical impulse rapidly. We need myelin sheath. So this is the function of myelin sheath. So what will happens? The myelin sheath will become degeneration. What in the case of multiple sclerosis? Okay, what will happen? The myelin sheath, MS, you can recognize multiple sclerosis with myelin sheath. So both are MS. In MS, what will happen? Myelin sheath will degenerate. Degeneration. Okay, or we will call demyelination. Demyelination. Where it will happen? We have central nervous system. We have peripheral nervous system. It will happen in central nervous system. So that is the reason it is very dangerous. Okay. Gradually the weakness increases. Okay. And second thing is the weakness in gradually progressive weakness like this, this weakness increases like this. The graph will increase like that. Okay. And as well as the whatever connection between muscles will be lost. Okay. So these are the things will happen because of the my demyelination. So this is the reason. What this is the main thing you have to remember about MS. What are the causes? Again, the causes are unknown. Even though our science is having very vast knowledge, but They are not unable to find the reason behind MS, and there are the number of diseases they don't know the reason. Okay, that's likewise also studied in uh, Bell's palsy, trigeminal neuralgia, other than an viral infection, hypertension, BP, sugar, anything. Here also the demyelination cause is unknown. Here they have to tell that there is a type of toxins which damage myelin sheath. Okay, the what is the toxin name here? Very important. That is myelinolytic ferment. This is the toxin myelinolytic ferment. What it will do? It will cause the whatever the blood supply to the myelin sheath. So it will stop the blood supply to the myelin sheath, and it will coagulate the blood within the vessels. So doesn't then the reason the blood doesn't reach to the myelin sheath. So what will happen? Our brain, our central nervous system, and even the axon, dendroid cell body need blood, oxygen, and in the blood we have oxygen, carbohydrates continuously. If the central nervous system doesn't get circulation from 3 minutes, okay, it will start dying. Okay, so there's the reason. So this is the type of toxin. It will damage, it will coagulate the blood who reaches to the myelin sheath, then the myelin sheath will start degeneration. Okay, this is one of the causes the scientists explain. Okay, so who will suffer with MS? So mostly the age group of 20 to 40 years. 20 to 40 years, mostly female, more than male, female will suffer from this type of diseases. Okay, so what are the clinical features? Very important. Now we'll talk about clinical feature. How a patient will start this disease. Clinical features. So let's start the clinical features. So first will the patient have paresthesia, means numbness and tingling, numbness and tingling in both the upper limb and lower limb. Okay, mostly in the legs. The patient have complaint of heaviness in legs. Okay, heaviness in legs or in one arm. Okay, it may be upper limb, lower limb, anything. Heaviness in legs in or hand or arm. Okay, and the patient have another thing, that is they have diplopia, double vision, double vision. So you have to ask the patient whenever a patient with numbness, heaviness, and have their double vision, and sometimes loss of vision also. One unilateral, one side or bilateral, both sides, loss of vision. And the patient have vertigo, giddiness. So this is very important. Other than that, so what are the clinical features? Paresthesia, numbness in the upper limb and lower limb, mostly heaviness in the legs and arm region. Okay, whenever they lift the hand, they have heaviness in that area. And the patient have diplopia, double vision. Okay, and sometimes unilateral or bilateral loss of vision and vertigo. So these are the clinical features. Other than that, we will divide in two things. Okay, according to the area is affected. If the affected is in the central nervous system, means in spinal cord or in brain. So what are the symptoms we will get or clinical features we will get? First, we will talk about spinal cord. Okay. In the spinal cords, what are the symptoms appear? Mostly here they have ataxic paraplegia, means in the all the limbs they have weakness, unable to lift the hand and legs. This is the one of the symptoms. And the second is the patient gait is very abnormal. Unable, the walking is very different from normal people. So this is the thing you have to remember. And along with that, the patient have urinary disturbance. Gait is abnormal, urinary disturbance or urinary incontinence, and other than that, in the other things, whatever we studied, the clinical features, along with that, we will be able to see these features if the spinal cord is involved. Okay, so we have to remember like that. Next, if the brain or brainstem, cerebellar, okay, affected, what will happen? What are the symptoms you will able to see? This is very important. So here, mostly loss of vision. Already we know about that. Okay, and the patient have tremors. Okay, and diplopia already you studied, impairment and deafness also present. So if the central nervous system is involved, what are the next symptom is deafness. Okay, deafness. This is the sign. Sometimes hemiplegia, one side paralysis complete, or sometimes all the limbs having weakness, muscles become very thin, muscular atrophy. Okay, and the patient have loss of weight. So these are the CNS issues you're able to see. So along with that, the patient have, if the weakness progressed in the central nerve, in the brain part, what will happen? Urine incontinence. Okay, and the patient having very uh, bad posture, unable to sit, unable to walk. Okay, unable to sit from himself. If he is disease is progress, unable to sit, unable to walk, or sometimes to talk, sometimes swallowing difficulty. So if the weakness are if the demyelination is spreading throughout the brain, so the weakness throughout the body will increase gradually. So it starts from the limbs, it ends to the throat swallowing. Okay, so these are the spinal cord, and the involvement of brain is very important. Okay, we have to understood that. Sometimes this will progress very rapidly. Sometimes it will take time. If his or her immunity is good, okay. That and if you, the is early diagnosis, if done early diagnosis, it will very be good. Okay, it will bring good results. Okay, but if the diagnosis is very later stage, so the patient will suffer, or he may be die. He or she die. Okay, so what are the diagnosis? What do they will do? The best diagnosis is the if according to the area is affected, is MRI brain or MRI spinal cord. Okay, or sometimes uh, the neurologist will decide which type of can have to be done, and we have to do CBP. Okay, sometimes we have to do. CSF analysis. Okay, CSF, cerebrospinal fluid can be taken whether there is an infection in that fluid or not. If there is an infection, what will happen? We will can see that the increase in uh, leukocyte counts or lymphocyte counts, lymphocytosis, because the infection is increased. So that's the reason we have increase in lymphocytes. So lymphocytosis will seen first thing, and second thing, the level of protein also increase. Protein level increases. So this, by matching both this, you can come to an end that the patient is suffering from multiple sclerosis along with the symptoms also. Okay, you need to match out the symptoms also. So this is very important to understood this. So let's see one image about the MS, explaining MS. So this is the nerve fiber axon. This is the myelin sheath which is cover of axon. This is the normal myelin sheath. You can see that this is the damaged myelin sheath. Damaged myelin sheath. Okay. Okay. Nerve affected by MS. This is the exposed nerve fiber. So the pulse or impulses, electrical impulses cannot be go forward without help of myelin sheath. So you can see lesions, any issue, central nervous system issues, numbness, tingling, pain. Okay, these are the things you can see. Other in other image you can see that. So you can see that this is the damaged neuron. Okay, this is the healthy neuron. So what will affected brain, vision will affected, mouth and speech, digestive system. Wherever the problem is there, you can see the symptoms: muscles, senses, urinary system, spinal cord, everything. Okay, this is the healthy neuron, this is damaged neuron, everything will be affected. So this will give the clarity. Okay, so what we have to do, we have to do two things here. If the cause is unknown, one thing is that according to allopathy, allopathy doctors, so what are the treatment, how we can approach? In allopathy, they will start immunoglobulins. I Okay, to improve the immune system. Okay, we will start immune immune systems, immunosupportives to increase the uh, immune system. So here, two things they can do. We have to stop the infection, and second one is to improve the neuron health or neuron. So first aim is to stop the infection and to improve the neuro health or neuron health. So this is very important. So again, I want to bring to you in electrohomeopathy. So how the issue is started. So this is the problem of blood. Okay. So you need to treat the patient because the infection is present in the blood. So the infection is doing coagulation. So the nerves, the blood supply to the nerve is or myelin is decreased or reduced or stopped to improve the circulation. So we have to treat this disease as a blood comparable. So blood utilization is decreased. Blood utilization is decreased. So what we have to do? We have to increase the blood utilization in the neuron. So it have to focus this thing. Very important. So what are the remedies and what are the treatment we go through to treat this patient. So basically, any place, you remember, please, any place where the function or structure is affected, it means the metabolism is ready. Metabolism is reduced. So what we have to? We have to improve the metabolism. We have the remedy S5. Metabolism is nothing but lymphatic drainage, lymphatic system. So again, you have to balance it. We are adding W. Okay. And along with S5, alternately C5. And we need know that there is an infection. So we have to add VAR1 GE. Okay. Or BE. First, you have to start with GE, then you go to the BE. Localized infection and in circulatory system, systematic infection. Localized infection and circulatory infection can be cleared with the help of G and B. Along with, you have to go deeper level. So you need C1, VER1, YE to decrease the level of infection. So we need multiple ways to treat the infection. C1, C5, Ven1G. This is also second as a antibiotic we are using, and we have to give the cellulized nutrition along with absorption capacity. So we'll add C1, A3, S10. So it will increase nutritional absorption, C1 as a cellular level, tissue level in the brain. So F1 also needed here. C1, F1, A3, S10. Okay. So this is very, very important. So this is as a nutritional improvement. So we are covering as a metabolism, as a infective wise, three medicines we are adding. First time in G, Y, and here you are also G. Sorry, G. So here you can take B because already you are taking G. C5 were 1 BE, C1 were 1 YE, and here G when one along with. Okay, because this is a chronic disease. Okay, along with that, you have to give application. Very important. Application, we have two options, WE or RE. RE as a stimulant, W as a nervine. So we have to apply or give a bath of RE daily. Okay, you have to apply all the affected parts, and you can add in some oil, apply to the four on the top of the head. But after that, you have to add WE. Okay, because to balance the stimulation. Okay, after half an hour, you have to add WE to balance the stimulation. So this is the basic treatment, okay, of MS. But other treatment purely depend upon the condition and the clinical features. Okay, sometimes muscles of lung, stomach, uh, intestine also affected. Urine incontinence, yeah, incontinence are there also studied, and we need diplopia treatment also. So we have to add multiple treatments when multiple effect systems are affected. Okay, then the systematic improvement we can see gradually we will reduce the medicines. Then we will only continue the CNS system remedies. Okay, so here we are adding only F1 here. Along with here we can add F2 also. F2 RE and F2 W. So nervine stimulant, nervine uh, effector. Okay, so both are needed here. So this is all about MS, multiple sclerosis. So we talked about what is a multiple sclerosis, what is the reason, and what are the clinical features who will affect in this MS, and clinical features, and as well as spine, symptoms and as well as brain symptoms, and what are the most common and sure shot diagnosis is CSF analysis and MRI. Okay. Other than that, if the patient have any other symptoms, you need more tests like if they have diplopia, you have to check. Okay, if they have urine incontinence, you need to do a USG ultrasound definitely. If they have swallowing difficulty, okay, whatever the system is affected, you need particular examination to know whether the system is affected due to the MS or any other reason. Okay, this is very important because this is a matter of life and death. So you have to treat the patient carefully under sub supervision. Okay, so this is all about and the treatment. And during this, the patient need application F2 RE very important. Okay, if the left side is affected, you need to advise F2I. Right side affected, F2RE. Back spine is affected, F2WE, or F2 is common, and F2RE, F2Y. Alternately, you can add that, and in between, I means first time you have to apply F2RE, second hour F2Y, third hour F2WE. Likewise, you can apply because all are very effective remedies for treating nervous system. So likewise, we have to apply and we'll get the best results along with internally, externally are having very good results. Okay. I have one case 2 to 3 months back of cervical spondylosis. It is very severe cervical spondylosis. L3, L4, L5. The space is reduced. Totally degeneration of spine is seen, and the patient having very severe left upper limb pain. Okay, so he got the uh he have very severe pain, unable to sleep, unable to sit, unable to lie down. Okay, so initially I gave only oral drops. After 1 week, he told that I have only 20 to 30% relief. So after that, I started application also, RE application. But this is left side, we need to Y application. But I applied in RE. So because he having severe effect. Sometimes you need to understand the condition also. But according to the rule, we have to give Y. Okay. So after that, after reducing the pain, I gave him a Y application. So the application is very important in electrical. So you need to treat the patient with orally and as well as application. Okay, you can add in the drops form, in oil form. Okay, and as a ointment form, any form. Directly, you can also apply the drops on the affected area. Okay, so this is all about in today's class. Any doubts? Kindly you can ask.